Is CO2 laser resurfacing worth it? In my opinion, for many people, absolutely yes it is. We have at our disposal now, be it surgically or non-surgically, a huge plethora of different treatments that do different things. But when we have someone come in with quite photo-damaged skin, this is skin that's been damaged by sun rather than just by the natural aging process, and people have deeply ingrained hyperpigmentation and particularly deep lines, and often what we see is this texture change. Most commonly it's around the perioral area, but it can be anywhere on the face. And you might almost look and the skin looks almost a bit leathery and quite coarse in texture. And in some cases, this can even lead to people developing actually what looks like blackheads from sun exposure, and these can quite often be seen around the side of the eye. When you reach this level of sun damage, there's no facelift that will correct this. There is no amount of injectables that will correct this. What we need to do is strip away some of that skin that's there, that's damaged, and encourage the growth of new, healthier skin. And that can only be accomplished through what we call full ablation. And that can be done with some types of laser, including CO2, and also through some types of chemical peel, particularly something called phenol peels. With CO2 laser, the laser itself is targeting water in your tissues. And since water makes up 70% of the human body, you can imagine that this is going to target a lot of the skin. And you can see visibly, particularly around the eye area, when you use CO2 laser resurfacing, you can really see that skin shrinkage that starts to happen. And people can get some quite remarkable results. Around the eyes, it can be absolutely stunning if someone has very difficult to treat lines and wrinkles and a lot of laxity. And around the mouth area, across the whole face, in the right candidate, CO2 laser is absolutely fantastic. However, you do have to be prepared for some downtime and for some level of risk, because you are stripping the skin back, and the skin is there for a reason. The skin's there to protect us. So you will find, if you don't follow the aftercare instructions properly and look after your skin, you're going to be very prone to infections. You're going to find that you're red for a relatively prolonged period afterwards. Even when your skin has healed, say 2 to 4 weeks later, you're still going to find your skin is red, and it's going to be extremely sun sensitive for a while. There's no point in going through a procedure like this if you can't practice sun avoidance during your settling phase and long-term look after your skin a little better than you did in your youth. And I'm not saying that in any way as judgment, because so much of our sun knowledge has come more recently. There are many people who along the way have sunbathed with olive oil on their backs or baby oil, because actually the knowledge wasn't out there yet. So this isn't meant in any way judgmentally. When we compare CO2 lasers to other devices, and here particularly I'm thinking about fractional lasers, the difference is that the CO2 laser is usually used fully ablatively, whereas fractional lasers leave these little columns of undamaged skin in between, which speed up recovery. And that makes the downtime a lot less, and also the risk a lot less. It also means the results are a little less dramatic. For many people, CO2 laser is a one-off procedure, whereas with fractional, you need to have repeated treatments. What I will say is these treatments are risky. They can be absolutely worth it in the right patients, but you need to make sure, if this is something you're thinking about, that you are in the hands of a true expert, someone from a medical background. In the majority of situations, this is going to be a very experienced doctor, and there are a couple of true laser experts who I would refer my patients for CO2 resurfacing to. So please do your due diligence. If this is a procedure you're going to go through with, plan for the downtime. Be prepared to listen to all these instructions. You might be taking 2 weeks off work. That isn't 2 weeks where you're going to be clearing out your cellar or reorganizing your attic, because again, that's going to increase your risk of infection if you're stirring up so much dust. This is a big procedure. It's a medical procedure, and you need to give your body time to heal, rest, and recover afterwards. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.